Hi there, my name is Lance Perez. I'm an undergraduate student majoring in electrical engineering here at the University of Arizona. During the summer break, I'm participating in the Summer Institute Medical Ignorance Program, and I've been working in Dr. Russell Whitty's lab. Dr. Whitty's lab, referred to as UNL, Experimental Ultrasound and Neural Imaging Lab that is, focuses on using sound as a non-invasive and robust medical imaging method. Our lab seeks to answer the question of how we can use hybrid imaging modalities to more accurately diagnose patients and improve treatment decision-making. Vibrational potentials are created when a pressure wave, like an ultrasound pulse, creates a temporary dipole in the ion surrounding, in our case, an electrode. This in turn temporarily creates an ionization electrical potential observed as voltage, which can be read by the electrode, thus giving us a vibrational potential signal. The question I had in mind for my summer project is whether we can use vibrational potential signals to know A, the location of an electrode in a saline bath, and B, verifies geometry. Now, what do I mean by geometry? In the case of the electrodes used for the experiments, there are multiple electrodes, also known as sites, encased in one plastic substrate. Geometry for our analysis refers to the center-to-center distance between sites and also the diameter of a site. The distance between centers of an electrode site is 4 millimeters, whereas the outside diameter, or the diameter of a whole site, is 2 millimeters. Here's a setup for performing a set of vibrational potential images. So here we have a saline tank with an electrode array, which again is just a bunch of electrodes known as sites encased in a single substrate. We have to think very carefully on how to submerge the array in the saline bath for two reasons. One, the array needs to stay stationary, or else the ultrasound can't interact with the electrode, so we can know the exact position it should be in. Secondly, any large piece of metal, like this optical post, can add a lot of noise to our target vibrational potential. Above the saline bath is a P41 one-dimensional ultrasound transducer. This well, once submerged in the saline bath, will send pressure waves which interact with the ions on the perimeter of the platinum electrode site, producing a voltage which we can record with the same electrode. The electrode array has connections which are fed through high-pass filtering hardware and collected on a data acquisition unit to process the vibrational potential signal. Okay, finally, 3 questions I came up with during my summer here at UNL are as follows. Is it possible to use vibrational potential imaging during surgery in real time? For example, would it be helpful to know the position of the deep brain stimulating electrode during brain surgery? Question number 2, if we can collect data in real time, how can we keep track of exactly where the electrode is if its location is constantly moving? How can we create some plane of reference? Finally, how can we make use of the images showing vibrational potential signals overlaid with images collected from MRIs or ultrasound to tell us something about the patient? Thank you for your time, and I hope everyone has a great rest of their summer.